Hello. Today we are going to discuss upper urinary tract infection. So basically we have two patients that came to your office and they literally reported the same symptom. So they reported symptoms of LUTS, which is lower urinary tract symptoms. So what are the symptoms? They have dysuria, they have urgency, like they feel they need to go and urinate very frequently. They have nocturia, it's either it comes or it goes, and then they have heaviness. So what you have to know is that this patient is very young. She's a young medical student. That's why she looks haphazard. And she is 27. So this UTI isn't like a complication in patients that are young. While this patient with the blue dress, she is old. She is 57 or 58, let's say. So she's very old. So having UTI makes it a complication for her because she probably has other diseases, and having UTI could worsen other diseases, having plenty bacteria in your blood. So what do? First, you send for a culture or urine analysis to see how many bacteria do we have in her blood, in her urine. And when you do urine analysis, you could also do a gram stain to see which bacteria grows. So as you can see, we have a variety of bacteria currently in their urine. And then we ask them this question: do you have upper tract symptoms, like the upper urinary tract symptoms? So what are the upper urinary tract symptoms? These are symptoms of acute pyelonephritis. These include flank pain, that's like back pain, fever, nausea, vomiting, and malaise. Let's say this patient, which is very young, said, no, I don't have upper respiratory tract symptoms. What do? You give her a therapy for 3 to 5 days only. You're like, okay, since it's not complicated, that means it's not complicated because acute pyelonephritis is always complicated. But this patient that said, yes, I have flank pain, I have fever, I have nausea, vomiting, diarrhea, and malaise, and she's like 62, she's very old. What do? You take a culture, you try to see the percentage of bacteria like we did the previous time, if it's more than 10 to the power 5. And then we see, is our patient severely ill? Like, is she having fever? Is she really, really sick, throwing up? What do? You give her IV therapy because she's severely ill. But let's imagine she has mild to moderate. She doesn't have symptoms. She has like very few symptoms. Probably she just feels urgency and frequency, but she doesn't have the heaviness. She doesn't have like blood in her urine or flank pain. What do? You give her oral drugs for 2 weeks. So this is the patient who doesn't have much symptoms. She does have upper urinary tract symptoms and she has lower urinary tract symptoms, but they are mild to moderate. So you give her tablets, oral drugs, okay? So imagine your medical students. Remember this medical students that we gave her therapy for 3 to 5 days. She came back to you in tears. She was crying and she's telling you, I'm still in pain. What do? So you take a culture and you measure the amount of bacteria in the culture. So let's say you take a culture and you have a lot of bacteria and it's positive. That means, yes, she truly has UTI. What do? Remember, you treated her for 5 days, then you treat her for 2 weeks. And if you do a culture after 2 weeks and she still has positive bacteria, that means it came back. It could be the same bacteria, which is relapse, or a new bacteria, which is recurrence. So as you can see, in this place, we have a green bacteria. When she came back, it was a green bacteria. And when you treated her for 2 weeks and she still has symptoms, and you did the culture and it's still positive, and you saw that the bacteria is still green, it means she has relapse. But if you see a new bacteria, this bacteria, as we can see, is yellow in color, that means recurrence. That means this is a new infection that she got. So it could be like frequent, it's more than 3 times in a year, or infrequent, less than 3 times a year. So if it's more than 3 times in a year, that means this person is likely to have more infections, more UTIs in that year. You give her like a suppressive therapy for a long time to suppress the bacterial growth. But if it's like less than 3 times in a year, you just treat each episode. So let's say this patient has negative symptoms. This same patient, you did the test, even though she's still in pain, she has UTI, but she doesn't have the upper urinary tract infection and pain symptoms. What do? And she tested negative in the blood culture, but she still have like dysuria, urgency. That means she has symptoms, but she doesn't have bacteria in the urine. So she has symptomatic no bacteria, abacteria. So this is basically it. This is the summary. This patient, she has acute acute uncomplicated cystitis. That means she has only the lower urinary tract symptoms. What do you give her? You give her Subtrine, that is the trimethoprim sulfamethoxazole for 3 days. You could also give her nitrofurantoin for 5 days. You could give her fosfomycin, just 1 dose, fluoroquinolone for 3 days, and beta-lactam for 3 to 5 days. Remember, who is this patient? This patient has only lower urinary tract symptoms. And let's say this patient with acute pyelonephritis, which is complicated if you remember, because we gave her IV drugs, as she has fever, flank pain, and she was in severe pain. So what do? We give her, the drug of choice is quinolone for 14 days. That's like Cipro and Levo. Or we give her an extended spectrum penicillin, which could be ampicillin sulbactam or piperacillin tazobactam. But we also need to add aminoglycoside to cover up for Pseudomonas. So we give aminoglycoside plus this drug. So this is the drug of choice. These 2 drugs together. So the summary again. This patient, if you remember, she's the patient with acute uncomplicated pyelonephritis, the one that we're going to give her oral. She tested positive for lower urinary tract symptoms. She tested positive for upper urinary tract symptoms, but she doesn't have fever and she's very young, which means her case is uncomplicated. Yes, she has pyelonephritis since she has upper urinary tract symptoms, but it's uncomplicated. But this patient, she has positive lower urinary tract symptoms, positive upper urinary tract symptoms. She has fever. She did a culture that was positive. And her age is, like we said, 58 to 60. So she's at high risk because of her age as well. And then she has fever together. So that means she has a complicated acute pyelonephritis. So as you remember, this lady was given oral IV drugs. You can see the IV line. She's on the bed receiving her IV drugs. So we give her IV. And this patient that has less on complications, we give her oral treatment. So basically this is the summary, and this is the basic treatment for acute pyelonephritis, complicated and uncomplicated. And for acute uncomplicated cystitis,